Here you go. Well, good evening, India, and a very good morning to our viewers in North America. Welcome to another session of Orange Neuroverse Live. I'm Vinay Singh with a team of incredible people who created Read On. For today's session, we have Dr. Shiba Singh, Mumbai's leading mental health expert. Dr. Shiba is the founder and director of Talkspace, a mental health studio in Hiranandani Gardens, Powai, Mumbai. She earned her PhD after winning a gold medal in Masters in Psychology. She is a passionate mental health practitioner with more than 25 years of experience in teaching, public policy, and now practicing with corporations and individuals to address grappling workspace and personal issues. Well, she's recognized as a mental health expert and the leader in the 6th World Mental Health Congress in Feb 2025, very recently, and awarded most prominent leaders in mental health space by World Mental Health Congress in 2022. There's a long list of awards and prizes she had won. But if I have to just say, she's a thought leader in the field of mental wellness, vast expertise. But if I have to just highlight a few which will be relevant for today's session, it will be parenting, behavioral issues in children, and treatment of anxiety, depression, OCD, and other psychiatric disorders. Well, it's a big topic today. I don't want to take away some time. Welcome, Dr. Shiva.
Thank you so much, Dr. Vinay. I'm so
Well,
glad to be here today.
well, it's my privilege, and we recently got connected, and thanks to our team, Sumita, who is your contact, and I have to take personal time to also thank Sumita, who is helping and making changes in the lives of so many children who are using Read On. And thank you for Sumita bringing Dr. Shiba to us so that we can have this session. But before we even start, tell us how you are able to do so many different things. What drives you in this space?
So, I started with, I actually started my childhood in a psychological setup. My father was a psychologist, and we are kind of a family of psychologists because my daughter also is a psychologist. So we belong to psychology. That's what my teachers used to say. That's what they used to tell me, that it's in your blood. So yes, most probably it's like that because I grew up in an atmosphere where we used to talk psychology only. So that drives me, and definitely people who are struggling, who are suffering, um, they are a great motivator for me to be in this profession.
That's well said. And I know you have done work with so many different organizations, and we picked up a topic that is very relevant today because even though if you look around, so many workshops, lecture, and on conversations happen, and especially during the Neurodiversity Week when we are talking a lot about these conditions, still a condition that is very common but still not very well understood, which is specific learning disorder. So I thought even if it is something that we can spread this message through this Neuroverse Live, that would be a session for our today. Tell us a little bit more about what is SLD or what we keep hearing about it.
So, Dr. Vinay, I would say people don't understand SLD and they misinterpret, or I would say they don't understand it fully. So, when I say they misinterpret it to be an intellectual disability,
Mhm.
whereas it is not an intellectual disability. A child who cannot perform academically doesn't mean that he cannot do anything else. So performing academically would definitely need IQ, but there are other factors also which influence our academics. The children who are not able to read, write in a normal way, we have to identify, we have to see whether it is something else other than intellectual disability. You know, and I would say that parents and teachers have to be very well equipped with the symptoms of SLD so that uh, they identify it in the initial stages. And it's a neuro developmental disorder. So it comes with the birth only. And it is not grabbed later by the child.
And when we talk about SLD, are there different types of SLD?
Definitely, yes. Yes. So I think after that movie Tare Zameen Par, people have started identifying the SLD, but they still don't know what are the different types of SLD. So whatever type of learning disability it is, we call it dyslexia.
Okay.
You know, but that's not the case. So dyslexia is one type of learning disability, which involves reading, difficulties in reading, writing, and phonological difficulties also, where children are not able to understand the sound which comes with a certain alphabet. So they don't understand whether B is B or A is A. You know, so they are not able to differentiate between the phonological sounds. Reading also, they are not able to read properly. um, uh, Writing, they are not able to organize things and write it in a paragraph or something like that when they have to appear in a test, or if they are sitting in a class and writing. It's very difficult for them to write when the teacher is dictating, because writing is tough for them because they don't understand the alphabets. They don't understand the sounds. And it's not their fault. You know, as I said, it's a neurodevelopmental disorder. So some change in the wiring, and that's why they are not able to do this.
So that
So
explains
that's
a lot of
dyslexia.
things. Yeah. Yeah.
Yeah,
So
that's
dyslexia. So people, when we are talking about learning difficulty, learning disability, and as you explained, dyslexia, is it? Are we interchangeably using the word SLD and dyslexia, or there are different ways to interpret them?
no. So SLD. So I will tell you majorly three different types of specific learning disability. One is dyslexia, where the reading, writing, and phonology is involved. There is another which is called dysgraphia. Dysgraphia is involved in writing only.
Okay.
So it involves your motor difficulty. So when a child is writing, he's not able to write properly. You know. So earlier, when I talk about writing in dyslexia, it is about the sound, not understanding the sound, not able to spell it right. But when I talk about dysgraphia, they are not able to write it properly. So the writing is not legible.
Okay.
Or sometimes you see when children write like this, they hold the pencil like this and they write like that. That's a difficulty in writing. So it is more concerned with the motor difficulty.
Okay.
So we focus on the motor part, the muscle. And then there is another one which is called dyscalculia, which is concerned with the mathematical abilities of the child or a person. Mathematical difficulties would be they don't understand the meaning of addition, subtraction, multiplication, division. That these are the basic calculations in mathematics. So they don't understand that. They so if you see if you can remember the movie Tare Zameen Par, there are these dancing alphabets and dancing numbers.
Right.
That's because the child is not able to identify any number. Child is not able to identify words, and that is dyslexia. So that was a symbolic movie, and it was not specifically about dyslexia or dyscalculia. That's why there was a jump. There was a cluster of alphabets and numbers. So talking scientifically, dyscalculia is about only maths.
No, and I've met people actually in personal life who would tell me that their words fly, and then when they are reading the books, they're just not able to focus or concentrate. But as I'm understanding, I think one thing that is coming out really well, that a lot of these things, when you explain neurodevelopmental, it is coming with birth, the wiring issue or rewiring thing that is happening, that is the wiring that is happening in the sessions, in their brain when they are trying to identify something. Uh, in that, is it happening where they're not able to, like when we talk about giving some technical words here, executive function, or not able to see those things or process that information. So tell me a little bit more about like cognition, because two things where you picked very interesting for me. One thing was the age, right? So you said it can happen for a younger person or it can happen in the older. Does it change with age? Does the signs of SLD change differ with age? How would you help me understand a little bit more about that?
So yes, so when a child starts, so say for example, around 3 years of age, whatever the child does at that time, so you would say delayed speech development. When I'm talking about dyslexia, so there would be the milestone is delayed. The child will start speaking late, or he will not be able to speak words in a very proper manner. So even if he can see and he can spell it, or he can read it, but he will not be able to say it nicely, properly. So that is the initial stage when around child is around say 3 to 4 years. So it depends on when he grows up, he goes to another class and he has to do multiple other things also, where he would find still another difficulty. So he would say have difficulty in recognizing a and the, you know, so he will not be, and very importantly and very common also, there are alphabet reversals.
Mm-hmm.
So B and D, he will
Right.
not be able to, and P and Q, so there would be a lot of difficulty in recognizing the letters. So which is very common. And I would request teachers and parents to look at it. So we laugh it off when kids behave like that, or when kids write ulta pulta, you know.
Yeah.
And the mothers, I've seen so many parents laughing it off, and they say, "Arey, they do like this, ulta pulta kar dete hain." You know,
Mm-hmm.
these are common mistakes or silly mistakes. So I would want them to actually look at it and see whether they are doing it very frequently, or it is a matter of just some practice. And so I would want them to pay attention to that. You know, when a child is around say 6, 8, 10 years old, 11 years old, and even so, there was this child who came to me, and I saw the notebook of that child, and he had written the spelling of and in multiple ways. So in the same page, he would write A and D. Somewhere he would write ADN. Somewhere he would write NDA. And it would all mean and.
Mm-hmm.
You know? So those kind of mistakes, which people may not understand that this is a symptom and we need to do something about it.
So more and more we understand like it is the cognition, their ability to see visually or perceive, or like a visual processing, or how they are processing that information is being. So are there ways for teachers who can identify SLD in classroom setting? Like I know they have to come to a professional, but can we talk a little bit about teachers? Because I know not regular our curriculums for the teacher curriculums have never been improved in a way that they can include sessions, because otherwise you go become a special needs education teacher. But then by that time you have already identified someone, and then they are going to a special education teacher. But in our regular teacher curriculum, I'm not sure. I still find once in a while we're not equipped with that information. But as an expert, can we give them some tips for teachers to identify and how to, it's a two-part question, how to identify and how to manage those things in the classroom?
Yeah, definitely. Teachers are I think teachers are the first ones to identify whether the child is behaving properly or whether the child is doing his homework or he's shirking work, he's shirking writing, or he's shirking coming to school.
Mm-hmm.
So we need to understand what's happening. So the teachers usually complain that the child is not writing anything in the class, or they say that their homework notebooks are empty, their
Mm-hmm.
classroom notebooks are empty, you know. So they need to see. So whatever symptoms telling you here, they need to check with the students with these symptoms, whether they are writing. Is the when they hold the pencil or the pen, are they holding it right? Or is there a discrepancy? If there is a discrepancy, we have to suspect that there is something wrong. Now, I don't want the teachers to conclude and I don't want the teachers to diagnose. But they have to just pick up these small things in children so that they refer them to a specialist. And I really don't want them to diagnose any child.
Well, no, they're not, obviously, they are not trained and they are not regulated in anywhere in the world where they could do a diagnosis. But as you said, rightly said, identification is the key, the very first step. So that, because as we understand that first time in grade first is like JK nursery, sometimes they're not even reading and writing. But if we can equip teachers with some of those really important key identifying, or maybe there are tools, and as I said, we do a lot of research in helping teachers identify, like at Read On, we developed this screen, which is a quick tool, in fact, a video game. So you play a video game, that video game will say you are able to understand certain words or not. Phonics based setup where we know if you are able to understand certain phonics, you're not able to pay attention. Some of the key cognitive parameters that are useful in reading and writing, we can do that. And some of those. So this is really useful that you are explaining that. And can teachers also manage those things in early days, or how as an expert you would allow them or help them to be able to manage some of the LDs in class?
Yeah. So, first of all, I'll take another 2 minutes to complete what I was
Yeah.
just saying. So here, teachers also need to identify any social or behavioral changes in the child
Right.
in the class. If the child is not very confident, if the child is hyperactive, or he's not able to concentrate in the class, you know. Now, so comorbid with SLD is ADHD also.
Right.
Comorbid is anxiety. Comorbid is depression. And I'm not saying SLD is the only cause of anxiety and depression in schools or in children. There may be hundreds of more factors related to that.
Absolutely.
But this may be a very important factor. So where the teachers identify that the child is struggling with reading something, child is struggling to write something, or the child is not able to say cope up with the curriculum.
Mm-hmm.
She has to suspect this. Also, she has to see whether the child is sitting at one place and doing it.
Yeah.
Because she has to also identify the behavioral issues connected with it. So when all these things are collectively taken, she may always refer the child to a specialist. Now, coming to managing this, how can the teachers manage it? Now, if the teacher realizes that the child is not able to write or the child is not able to read, so she can give them some audiobooks.
Yeah.
Or because they would learn, the child who is not able to read will be able to learn when somebody is telling him something. So orally he would be good because there is no issue with the IQ. He can understand things, he can comprehend things. But while reading aloud, so sometimes teachers say, okay, stand up and read. The child will always shock to read it because he's not able to read it. Even if he is able to read it, he will not be able to comprehend it.
Mm-hmm.
So after he reads one paragraph and you ask him later, okay, what do you understand? And he may not understand anything because he has only read. He's not understood anything.
Yeah.
So when the teachers identify things like that, they may give them an audiobook or they may help them with extra classes where they take them one to one. They may also bring them from back bench to the front bench so that they are able to concentrate and also the teacher can pay more attention to that child. And also we have, say, IEPs, like individual programs for these children. So we can customize programs for them. So teachers can also, and teachers are trained in that. Teachers also can implement that and take help from special educators who can make some individualized program for these children.
Right, right. So you're obviously advising the strategies in terms of helping children with specific learning disorders. One, accommodation, like you suggested, having the use of audiobooks, having use of certain tools. For example, I have seen certain grip objects which people can use it for holding the pencil in a different way to help those kids. Those accommodations, and then would you recommend or suggest any interventions for those specifically out of a classroom, or you would say it takes time, can it be managed, or I would not presume that they could be cured because that is not what is the treatment is doing, but can it be managed to a level that they are able to cope up, that so it's a less anxious, less anxiety, but they're still able to manage in a day-to-day life, that they start to realize that that is the new way? What would you suggest in that case?
Definitely, it can be, say, I would not say, like you said, that this is a treatment which will help them do better.
Right.
And this is not a treatment to erase it fully. That is not possible. But with practice at home, in school, where they are given a little more attention, they can do much, much better. Definitely.
That's interesting. That's very good. And at Talkspace, tell me a little bit about your studio and how do you help parents or teachers as an organization?
So yes, Talkspace. We created Talkspace in 2022, and we are a group of 5 therapists. Plus, we have a special educator also who comes to us and identifies and screens children for learning disabilities. Um, Also, we recommend occupational therapy to students who are not able to do it. So, occupational therapy helps a lot. Here, definitely when people come to us, so we work here in the center where, say, students are referred to us or parents come to us with their difficulties. They are referred by teachers also, by schools also.
Mm-hmm.
So we look after them and we have sessions here for students who have learning disabilities, starting from mild to severe. We
One.
also see Talkspace because we deal in mental health.
Mm-hmm.
So majorly we also help people in their behavioral issues and psychiatric issues. So like earlier when you said anxiety, depression is our core, and all our therapists are well trained and well educated in anxiety and depression, and majorly we use cognitive behavioral therapy in the center.
That's nice. No, we, as the organization Orange, we were involved with a large study with corporates to identify if LD ADHD as a undiagnosed LD ADHD as a source or a reason for corporate anxiety or the workplace fatigue, and they never had this one 40 years ago. People who are in my age group, I won't identify now. 40 years ago, when people were in schools, there were not enough awareness, and they went through. Sometimes they coped in a different way, and then now there some of them are very successful professionals. As we know, a lot of engineers always have difficulty with reading and writing because math and brain, but when they have to write, they're always anxious. So really interesting way to do that, and I'm glad that Talkspace is leading the work. Tell me something that would, if one nugget you have to give through our Orange Neuroverse live, what would you say to people who are struggling with SLD, especially adults?
Yes, especially adults. First of all, accept that you have SLD. If you have been diagnosed with it, or if you identify that you have some difficulty in reading and writing and in maths, or in maths rather, I would say go screen yourself. Take help from a professional. First of all, identify and then go to a professional to screen yourself, and then practice. And very, very importantly, people mistake it as intellectual disability, whereas it is not. This has nothing to do with your intellect. This has nothing to do with your IQ. You can be very smart, but there is a specific difficulty that is in writing or in reading or in maths. That doesn't mean that you cannot do anything else. We have examples of so many people who have done great in their life but had a specific learning disability. So there is nothing to hesitate. Please go ahead and normalize it. That's what I want to say. I want to tell.
That's great. And as